Thank you, Madam Speaker, and good morning. My colleagues, I've come here this morning to talk about this health care bill. This Senate health care bill that we passed continues to spend far more than we have, and at a rate faster than anyone could have imagined. So the bill itself is chock full of budget gimmicks to game the system to show that it's revenue neutral. I'm briefly going to outline this morning why it's not revenue neutral. In fact, future Congresses will repeal some of these cuts in Medicare and some of the taxes, like the tax on certain health care plans. The President indicated that he would veto any health care bill that created a dime, a penny of deficit. Well, Mr. President, I hope you're listening, because I've gone through the scoring on the health care bill, the Senate health care bill, and there's a chock full of gimmicks. And in fact, this creates a deficit. Let's take a look at them, because these savings that the CBO scored will not be achieved. And let me first of all start by saying there's 10 years of taxes to pay for 6 years of benefits. That's one of the tricks we should realize. Many of the taxes will start immediately, yet the health exchange does not begin to 2014. The two large cost drivers are Medicare expansion and the health care exchange. But there are only 6 years of the exchange cost in the budget window. So if we're going to have tax for 10 years and we're going to institute the program much later, those are cost savings. But once this thing gets going, after 10 years of taxes and 6 years of benefit, what happens after that? No one knows. Obviously, it's going to be a deficit. That's the first thing I want to start out with. There's cuts throughout this and to Medicare. Now, they are fiction. Let me give you an example. They have a 21% in what's called the SGR, which is Sustained Growth Rate, funding rate for physicians. So they're going to cut physicians, their SGR, by 21%. And they're going to do it a 2% cut every year for the rest of the decade. So this will require a $280 billion cut. And to correct it, we'd have to do a fix. Now, is this going to occur? Well, remember now, we just passed H.R. 3961, is a doc fixed. So they're already agreeing that we have to fix Medicare for doctors, yet they're going back into this health care bill and cutting them. Now, there's $156 billion in cuts to the hospital market basket. Now, this is a reimbursement formula used to calculate payment rates. Can we realistically expect to provide a negative cost increase to hospitals, or are we creating another so-called SGR type situation in this bill? Now, they have what's called $70 billion in community living assistance services and support. This is a new entitlement. It's an insurance program for assisted living programs. However, it does not collect enough and pays out too little. It's estimated this program will become insolvent in 2020. Senator Kent Conrad has called this a Ponzi scheme of the first order that would make Bernie Madoff proud. Another fictitious claim, $15 billion cut by the Independent Payment Advisory Board. Now, this is an unelected body who will be able to force Medicare cuts and reforms throughout the system. Congress can only vote to stop these if 3/5 of the Senate votes to stop the cuts. Now, they have continually talk about tax on Cadillac health care plans. They use this as a saving of $32 billion. You know whose Cadillac health care plans we're talking about? We're talking about unions. They are the ones that would be affected. Do you think the Democrats are going to tax union Cadillac health care plan? That's not going to occur. So I tell you that once this gets passed, they're going to repeal this tax at future points. 10 years of taxes to pay for 6 years of benefits, I mentioned earlier. The two large cost drivers are Medicare expansion and the health exchange, but there are only 6 years of the exchange costs in the budget window. So again, that's a gimmick. These costs were not included by the CBO because they would not be subject to future appropriations or not mandatory spending. So that's why the CBO didn't include these. $10 billion to hire about 16,000 new IRS agents to enforce the individual mandate on every American. So CBO did not include this in the scoring because it'd be subject to future appropriations and not mandatory spending. So CBO didn't even include that. And what about all the number of employees going to be hired by Health and Human Services to operate that? That's not in here. $55 billion for new bureaucrats to run this government expansion into health care. None of that the CBO has in there. So the President, Mr. President, you should realize you signed this bill, you're signing a bill that's going to create deficits.
The gentleman's time.